started off as a young aspiring physician, very interested in neurological surgery, and that's the route I pursued initially. After couple of years, I decided to change path to neurology, but I still like the interventional aspect of it, the surgical aspect of it. So I found interventional pain as the best fit to, best of both worlds, to give me the type of quality of life that I was looking for, as well as keeping me really involved with the interventions and procedures. Neuromodulation has been a huge passion, including spinal cord stimulator, peripheral nerve stimulator for essentially any nerve that's out there in the body that can be accessed, as well as dorsal root ganglion stimulation. Those are really great outcomes we're getting from them, and it's significantly life-changing for patients who have not been able to find relief for so many years after going through a variety of different treatments. We have a multidisciplinary approach to pain, which, because I think painful conditions are not, especially chronic pain, is not a single specialty type of condition. It requires multidisciplinary approach. So anything from ancillary services like physical therapy, acupuncture, chiropractic treatment, or with psychiatry, psychological treatments, as well as medication management, interventional. They are all involved, and we have great collaborative work with all different teams as such, and try to offer the best treatment options to the patients in the most comprehensive possible way. One of the very first experiences I had being able to offer treatment making a significant difference in a patient's life was I had a patient who was seen in the clinic after she had to be relocated because of a fire to her house, and she had to move down to the area to live with her children. And for the longest time, she had been on massive amount of opioid medications and without any further evaluation or treatment, and they just continued prescribing medications. When I look back at her history at where she used to live, she came to my office requesting for the same thing, and I refused to offer her that medication that she was asking for, and suggested certain workup to be done. She left and came back a few months later without getting any of the workup done, asking for the same thing again. And in the meanwhile, she had been to several different practices getting medications. And I had my conversation with her again that, this is not what I mean, the medications are not what I can offer her, but I do have other options. I just need, her to get her workup done, and we figure out what to do. But she was very adamant that she didn't want anything other than medications. Literally, as I was walking out the door, her daughter, who was in the room, asked me, okay, what workup do you want? We'll get it done. We'll bring it to you. Next thing you know, they got everything done. A couple of days later, they brought it in. We evaluated and figured out what we could offer her. She was a great candidate for basivertebral nerve ablation or Intracep procedure, which we got it done very quickly for her. Within a couple of weeks, we were able to get her to get the case done. And the week after the procedure, when she came to the office, nobody in the front desk could believe she's the same person. She used to come in very disheveled, on a wheelchair, unkept. The day she walked in with a walker, barely using the walker, on her feet, not needing any medications, neat and clean, and very happy with the outcome of the treatment within less than a week from the procedure. Luckily, at this point, I've had many patients who we have managed to help them come off of medications completely. It doesn't happen overnight. Again, it requires a lot of trust, mutual trust between the two parties, and patience to slowly, because there are two different aspects we are trying to treat. One is the underlying painful condition they have, but also over the course of years, they have built a lot of physiological dependence on the medications, and you cannot just cut off the medications. Even if you have treated the underlying painful condition, you cannot just cut off the medication. So you got to work with them on a weekly basis, monthly basis, and gradually work on tapering medications while offering alternative solutions to their pain. And a lot of it also takes education for the patient to know what to focus on, what the pain medications are doing for them, what the other treatments are doing for them. So when the patients come, I've had quotes from patients that I have relieved them from the prison of their pain of 20 years after a simple injection. Nothing can beat that. when they come back to me and tell me, this is the first time I was able to sleep for 8 hours straight after so many years since this pain started, nothing can beat that. So that's all rewarding. It's not always like that, but it is. That's what keeps me passionate and keeps the drive going. So I keep seeking for solutions that I can offer to get to that type of outcome with my patients. It's a new evolving field, and there's a lot of research going on, a lot of effort into building the evidence to show that what we are doing is really working for patients. Even though it may cost, but it does work. And in the long term, the cost benefits would be in favor of payers. It may be bigger costs up front, but in the long term, with considering all the clinic visits, all the ER visits, all the complications patients will have from chronic pain medication taking, as opposed to getting their underlying condition treated and moving on with their life, the benefits it can have to their own life, their own functionality, it's huge. There's a lot of development and research going on in the field of interventional pain, which is very promising for the future. We've come a long way, but the future is bright. The reality of it is a lot of what we are doing right now, and especially advanced interventional pain, is not very commonly known. So education would be a huge aspect of our responsibilities, people like me, to be able to educate people, tell people what's out there and what can be done. Because right now, I see this oftentimes. Patients come to see me, something is done for them. Initially they were very hesitant, but once it gets done, they go back to their referring physicians, and now we get flooded with patients because they're seeing the good outcomes of what we are doing. And this is anything from chronic back pain, patients who have had failed back surgery syndrome or whatnot, all the way to patients with chronic painful diabetic pain, which nobody would think of. Painful diabetic neuropathy can be treated with an intervention like a spinal cord stimulator, but it's been better than any medications that's out there in relieving pain and improving patient symptoms, and even bringing back some of their neurological deficits, which have been gone for years.